If you believe you have depression, should you go to your family doctor or to a mental health specialist? There are two possible answers. You should go to your family doctor if it's more convenient for you, and if he or she is using the STAR-D algorithm for treating depression or the Texas Medication Algorithm Project algorithm. In fact, using one of these algorithms, your family doctor will get better results for you than if you go to a specialist who is using the usual treatment for depression. But the real world answer is that you should probably go to a mental health specialist because of insurance rules. In the Sequenced Treatment Alternatives to Relieve Depression study, called STAR-D for short, it was shown that results of depression treatment were the same whether or not the patient went to a primary care physician or to a psychiatrist when both used the STAR-D algorithm. And the results for both were better than the results obtained with the usual treatment, the kind of treatment that most psychiatrists and most primary care doctors give. But the STAR-D had detailed guidelines which all the doctors followed when they treated the patients in the study. It was following the guidelines that caused the depressed patients to do much better than the patients treated in the usual way. The Texas Medication Algorithm Project developed an algorithm very similar to that of STAR-D, and also an excellent manual that explains in great detail how to use the algorithms. I think it's a good idea for patients and doctors to look at the manual and the algorithms, and I've included the link on TMAP manual on the end title. So that's the first answer. Yes, your family doctor can do as good or better job than a mental health specialist if your family doctor is using one of the algorithms that I just talked about. But the real world answer is that you probably should go to a mental health specialist for depression treatment because of insurance rules. Modern effective treatment of depression using one of the algorithms means a lot of visits to the doctor to find the best treatment. Texas Algorithm recommends that after the first visit, return visits be scheduled at 2 weeks, 4 weeks, 6 weeks, and 12 weeks for many patients. And at each visit, the patient should be assessed to see if the symptoms have gotten better, and if the symptoms have not completely gone away, then the dose of antidepressant should be increased, or a different antidepressant should be tried depending on if the patient has had any side effects. This is much more than is usually done for patients receiving the usual treatment from a family doctor or a mental health professional treating depression. And remember, the usual treatment is about half as effective as algorithm-based treatment. The problem is that due to insurance rules, many family doctors aren't able to follow the algorithm treatment plan. Many family doctors work under insurance contracts that have what are called mental health carve-outs. The carve-out says that the insurance company will not pay for mental health care delivered by the family doctor. Rather, the patient needs to go to a special mental health company that the insurance company has contracted with. These companies are called managed behavioral health organizations. Most likely, your health insurance does have a mental health carve-out. One recent estimate was that from 100 to 180 million people had health insurance with carve-outs. Some primary physicians may go ahead and treat patients for mental health problems, knowing that the practice won't get paid, but it's very unlikely that they can afford to use the time-intensive algorithm protocols because of all the money the practice would lose on each patient if they did. But the key to getting the best treatment for depression is to go to a doctor who's using the TMAP or STAR-D algorithm. You can download the TMAP manual with algorithm and forms free on the internet. Again, the site is on the upcoming end credit. Well, that's it for today. Thank you for visiting, and I hope you found it useful.